why you picked a job as a hospitalist PA? What is your responsibilities typically? How much do you make? What's your salary? Would you say you would choose this specialty again, knowing all that you know? Hi, everybody. Welcome to DaniThePA Podcast, where I am on a mission to find the coolest PAs and their jobs out there, where we're going to talk honestly about medicine and life beyond the highlight reel that you see on social media. I'm Dani, your podcast host, and today's guest is Marissa, my PA school bestie. She is a hospitalist PA, so we're gonna find out all about her role and what you do on a regular day. So first of all, welcome. Thank you for coming.
It's an honor.
Appreciate
Thanks
that.
for having me.
So tell the listeners who you are, what city or state you practice in, what specialty, and how many years of experience you have.
So hey guys, I'm Marissa. I am a hospitalist PA. I have had the same job since getting out of school. We graduated back in 2021.
That's pretty crazy.
Working in South Florida. And it's honestly been a dream. I got very, very lucky with my job. And yeah, it's been great so far.
Yeah, I've switched jobs probably like 3-4 times since I graduated PA school. So the fact that she's been there almost 5 years means you
have had a lot of jobs.
I have.
But that's also kind of good.
I'm a job hopper.
Yeah.
But so about your role, can you tell me why you picked a job as a hospitalist PA? You probably could have chosen any specialty. Was it just a connection, something you landed on, or did you actually like want this specialty when you graduated?
It was actually a little bit of both. So I really wanted something mostly in the hospital.
Yeah.
I don't love outpatient medicine. I don't really like the doctor's office environment. I don't know if that's just because like I'm used to being in the hospital because I worked in the ER as a paramedic before PA school and I'm just more comfortable with it. But I also just kind of like the fast
vibes in the hospital are nice.
Yeah, and it's like high acuity and things move faster and I kind of like that. So I wanted to be in the hospital. That was probably the number one thing for me. And then I also wanted something broad, like internal medicine. Yeah. And that's literally what I got in this job. You know, hospital medicine, it's internal medicine, but acute care.
Yeah.
So it's worked out perfectly for me. And I got it through a connection. It was actually through my preceptor.
Oh, wow.
For internal medicine while we were in school.
I didn't know that.
Yeah. I had 2 internal medicine rotations. It was my second one, which is technically the elective. And he recommended me to my now attending.
That's amazing.
Yeah.
So
super lucky.
People always talk about like PA school rotations being like interview-ish.
For
it
sure.
Definitely is in your case.
Yeah. I think connections are big in general with getting jobs.
That's like how everyone gets their jobs,
right.
Especially as a new grad.
Because when I was looking online,
I
didn't see any, not what I wanted in like a job. I didn't see a lot of listings that were really my vibe.
Yeah.
You know?
Okay. That's pretty cool. So in your role as a hospitalist PA, what is your responsibilities typically?
Yeah. So, I mean, first of all, the whole gist of my job, of what hospitalists do, is we admit people from the ER to the hospital. So people who are super sick and need to stay for further care and management, they come to me. So I'm basically the admitting PA. I don't typically, just because of like my specific shift and responsibility, I'm not typically doing follow-ups or discharges. I'm solely doing new admissions.
The admitting orders typically.
Yes.
And then you don't follow the patient through typically.
Correct.
Okay.
For the most part. If my attendings need help, then I do. But for the most part, I'm just responsible for new admissions. So I'll see them whether they're in the ER or whether they're already admitted upstairs. And, you know, I'll have an idea on what's going on based on the ER's note. But I go through chart review, labs, imaging, and then I have to do, obviously, a more in-depth exam, history,
make sure you're not missing anything.
And, you know, get their entire past medical history, their social history, you know, their social support, everything. Yeah. And then come up with a treatment plan based on that.
Yeah. And that, like, kind of almost dictates their hospital stay.
Correct. Yeah. Admissions are a little bit more work.
Oh, 100%.
Yeah.
Yeah. So typically, I know this can be like dependent on the day because obviously I work in the ER and I give you all the patients. But roughly, how many patients do you typically see in a shift? And how long are your shifts typically?
Okay. So it is literally always different. I typically, because I work evenings, I'm usually...
What are evenings?
Evenings,
what time-ish?
like I'm getting to the hospital like 4:30, 5 o'clock. And I'm technically responsible for seeing all the admissions that have come in since the morning, essentially, until 11 p.m.
You're telling me people are sitting without orders until you get there?
No.
Oh, okay.
My attendings will go, they'll put in basic admission orders, right? And they'll go and eyeball them and put in like whatever needs to be ordered.
Emergent
like
vibes.
if they're here for COPD exacerbations, they'll throw in Duonebs or antibiotics. Or if they're in pain, they'll put in something for pain meds. But the bulk of the admission is me.
Yeah.
Yeah, but they're still seen by a provider before I get there.
So you get there 4:30.
Yeah.
You leave at what time-ish?
Well, I live in probably like an
you
hour.
leave the hospital at what time?
Oh, leave the hospital?
Like you go back home.
It's literally always different. I usually, because I'm only responsible for admissions until 11 p.m., I'm usually out of there around 11-ish. However, if it's super busy and my patients are really complicated, because I'm also when I'm at work, I'm the only provider from my team who's there. So even though I'm only responsible for seeing new admissions, I'm also responsible for technically everyone in our service.
Yeah.
If something happens, if someone starts to decompensate, I have to manage it, right? So I'm kind of taking care of little fires between seeing my new admissions.
Yeah, 100%.
And sometimes when they're really sick and they're complicated and it takes so much more time, especially if I have to have conversations with family members, which is quite often, it adds a lot of time. So usually I'm out by 11, but I have left the hospital at 2 a.m. before.
Yeah.
You know?
That's a very like princess shift in my opinion. 4:30 to 11.
100%. Because on average, I'm really only in-house probably 6 hours average.
How many hours do you work a month?
Always different because of my shifts. But I work average probably 17, 18 shifts a month.
So you go to the hospital 17, 18 times and you work like 6-hour shifts ish.
Yeah, ish. And then, so I'll leave the hospital around 11, but then I'm on call till 6 a.m.
Oh.
Not that I don't have to go back into the hospital, but I just take calls. So if the nurses need anything, if the ER has new admissions for me, if anything starts to happen.
So that's a work from home opportunity right there.
Yes.
You work.
Yes. Technically, yeah. I do work from home.
Okay. So on call after you leave, you work a few hours each shift, responsible for people who are there when no other providers from your group are there. And how many people in your group?
It's just 2 other attendings. Okay. But it's only 1 on at a time.
So for the listeners, this is kind of different for like a hospitalist PA because typically from what I've seen, hospitalist PAs, they work 7 days a week in a row.
Yeah.
Typically 12-hour shifts.
Yes.
So you've got kind of a sweet gig.
I have a very good gig. Again, I got super, super lucky. But we have that luxury and the flexibility because we're a private practice.
Yeah.
So we can do that. We can set up our own hours and kind of do things how we like. And it works better for us. And I think like it also helps the overall care that we give being more flexible and like not overloading us because we can give more time to the patients.
And you're more fresh.
Yeah.
And you're more willing.
Not burnt out. Yeah, exactly.
That's pretty cool. So tell me, obviously it's all in the hospital. You're not doing any outpatient or anything like that. And then
that's how I like it.
How independent do you feel? Like, do you feel you are pretty independent at this point in your career? Are you consulting, you're supervising, attending on most patients, or what would you say?
I would say that I am, for the most part, I'm virtually 100% autonomous.
Okay, cool.
I am doing everything on my own. Obviously, I will run things by them.
On the more complex patients.
On the more complex patients, if I'm just like not sure about something in particular, give them a call. I'll let them know kind of what's going on. But for the most part, I'm managing it all on my own.
That's pretty impressive. That's cool. So she's like very smart, y'all, because being a hospitalist PA is like, you have to know everything about everything.
Very broad.
Yeah.
It covers everything.
Yeah, you're managing COPD exacerbations, heart failure, kidney failure, sepsis, stroke, GI bleeds,
a lot of cancer
It's
patients.
a lot. That's impressive. Because in the ER, like when a patient
is
really
yours is broad as well.
Yeah, but when a patient is really sick, I kick it off to y'all.
That's
and
true.
It's over. I'm done. You have to actually manage it. So that's pretty cool. So I think a difference between my role and your role is I do a lot of procedures in the ER.
Yes.
You don't do much procedures, right?
No.
Do you do any?
Only here and there. rarely, but it's usually small things like helping out the nurses because this is only because I worked as a paramedic for years. I'm very good at IVs. So if the nurses can't get an IV, I'll get a line for them.
That's nice.
If they can't get a Foley, I'll help them with that.
Okay.
Otherwise, I'm not really doing a lot of procedures.
That's cool.
Yeah.
Sometimes procedures are a little annoying.
Yeah. And they also eat up time,
Yeah, exactly.
you know?
Okay, cool.
Find it.
So we already discussed a little bit about your schedule. You work around 17 to 18 shifts. Do you work weekends, holidays? Yeah? You
Yeah.
rotate weekends, rotate holidays?
I'm the only main PA that they have that works full time with this practice. So yeah, I'm kind of expected to work holidays and
Every holiday?
no.
Oh, okay. You
No.
rotate.
Yeah.
Yeah.
And it kind of depends on the holiday. So like, for example, for Christmas, my attendings don't celebrate.
Yeah.
So they work,
Okay, cool.
you know? And like for Ramadan, I'll help out a little bit more,
Yeah,
you know?
that works out.
Yeah. And I typically work a lot of weekends, but not the full weekend, if that makes sense.
Yeah,
You know?
makes sense.
It's okay. Because I don't mind it because then I have days off during the week, which is kind of
Yeah,
nice.
I love that.
Yeah.
Okay, cool.
Yeah.
Do you feel that someone who's maybe looking to grow a family or something of that nature, do you believe that your schedule and setting is like sustainable for
Yeah.
that? Yeah.
Yeah.
Yeah, you have a lot of downtime.
I do have a lot of downtime.
Okay, cool.
I think, but that's like my role specifically.
Yeah.
And like you said, it's kind of finding this kind of hospitalist job outside of mine, I think
It's rare.
it's kind of rare.
Yeah.
To my knowledge, I don't know,
Yeah.
but
I guess we'll find out through
Yeah.
this podcast. Stay tuned. So if you're comfortable sharing this, most people really want to know ballpark specifics, whatever you want to give.
Yeah.
How much do you make? What's your salary? You don't have to give specifics, just a general range if you prefer that.
okay, I can give you a range.
Yeah. What would you say like a hospitalist PA should start at?
The thing is, I am paid like differently than most. I'm not paid hourly or salary. I'm paid per patient
Really?
and per call shift.
Holy crap. I'll see all the damn patients. What the hell?
Yeah.
That's cool.
Yeah. So
All right.
my paychecks are different literally every single month.
Oh, is that good or bad? Sometimes
It's fine. I don't mind it because like sometimes I get more than average.
it's slow, you're
But if I take vacation, I'm not getting paid for that time.
that's interesting.
Yeah, it is. I don't know of any other
I've
job
never-
getting paid.
I don't know if I've.
But I don't mind it. Because for the most part, we're pretty stable.
Yeah.
We're not slow on business. There's always sick people.
Yeah, unfortunately.
Coming to the hospital. Yeah, exactly.
Yeah.
So business is not slow.
Yeah.
At least right now, knock on wood. But ballpark, I make between 120 and 130.
That's fire. That's good. It's really good. And that's specific. That wasn't no ballpark.
I know. I was like, whatever, I'll just say it.
Yeah.
Who cares?
That's good.
Yeah.
That's solid.
Yeah. I think I started around 95, 100,
Yeah.
something like that, which I feel like is average, right?
Yeah, for a new
Would you say?
grad. Yeah, we're a dumbass when we got out of
Yeah,
school.
exactly.
So,
I think
yeah.
anything less than that is kind of, I don't know if I would.
Yeah. Then you're just doing a disservice to the profession at that point.
Yeah.
Because then they'll just hire new grads all the time.
Yeah, exactly.
And screw the people with experience.
Yeah.
Okay, so you have a very unique pay structure, but what about any benefits, any PTO, any overtime pay? Well, you get paid by the patient.
Right.
No night differential because you get paid by the patient. So all these questions are stupid for you.
No, I see what you're saying though.
Yeah.
So benefits, none. I'm a
You're
1099
independent? Okay.
independent contractor. No benefits, no PTO.
Yeah, because you're an independent contractor.
Yeah, which I don't know any different.
Yeah.
You know, this has been the only job since PA school,
Yeah.
and it's been working for me. Granted, I don't have a family. I don't have kids.
Yeah.
I think that would be harder if I
Without like the health insurance and all that.
Yeah,
Right? Yeah.
I'm.
Well, like right now, I have benefits, right? And I work for a huge organization. I
Yeah.
have United Healthcare. It's still $600 a month for
It's
me and my
nuts.
son and my husband.
Yeah.
So it's like I feel like I'm paying out of pocket anyways. So
Yeah.
I don't know if you're losing that much. Right? You know?
Yeah, that's true.
Just get disaster coverage and
Yeah,
Wing the
exactly.
rest.
Kind of ironic that
Yeah.
healthcare providers have such a hard time getting healthcare.
yeah, and no sick days. That's weird too. I get no sick days.
I mean, I call out if I need to, but I'm not getting like any kind of pay.
Yeah.
You know what I mean?
Yeah. Okay, so a couple more questions. What would you say the best part of your job is?
The best part about my job, I like that my job, it's always stressful. I think working in the hospital.
I said the best part.
I know, I'm getting there.
Okay.
I'm getting there. It's always obviously super stressful being in the hospital, dealing with the acutely ill.
Yeah.
But I'd say it's super fulfilling.
Yeah.
Like in the hospital, the lows are very low, but the highs are really, really high. I feel like doing something good every single day.
Yeah.
As cliche and corny as that sounds.
Yeah.
Yeah, that's probably my favorite part.
That's nice. And you
Yeah.
see the recovery in the patients, right?
Yeah, I see them get better. And, families are always, not always, but for the most part, they're very grateful and they're
Yeah.
warm and thankful and appreciative. And
How
that's always
sweet.
nice.
Marissa,
I know.
you're so cute. Now,
Sometimes.
what would you say the worst part of your job is?
The worst part about my job, for me personally, is probably the tough combos I have to have with patients or family members, whether that's delivering bad news or it's having the end of life goals of care conversation.
Yeah.
Both super tough.
Yeah, nobody
obviously.
likes to hear that.
And you know what? Like, I don't know about you. I feel like no one's really taught how to have those conversations.
And even if you're taught, that comes with
it's
experience.
just with experience.
Yeah.
And they're also so different than all my other conversations at work. You know what I mean? Like all my other combos are very objective, like this is what's wrong with you. This is what we found. This is what we're going to do about it. And these other end of life combos are obviously not. Like they're very emotional and they're nuanced and they're heavy. And you have to have these, inherently very emotional conversations, but void of emotion. And it's kind of hard to do, but that's how you have to do them as a clinician. And they're tough. And apart from all of that, they're just sad. Like it sucks being the bearer of bad news. You know?
It takes a lot of skill, I feel like, in the way you say things, how you say it.
And they're very tiring. They're exhausting because you're just doing so much like mental gymnastics the whole time. Because you're kind of like walking this very fine line between being really clinical and objective and firm and clear while also trying to be like empathetic and warm and understanding. And sometimes it's hard to like reconcile both those sides. You know what I mean?
Not everyone even has that to this day.
Yeah.
All right. And would you say you would choose this specialty again, knowing all that you know?
Yeah.
Yeah?
100%.
Do you see yourself transitioning ever?
If I get burnt out, maybe.
Yeah.
But like...
You're not burnt out?
No.
Oh. Okay.
Are you?
I guess we'll have that conversation on another podcast.
I mean, listen, it's only been 4 years. In the grand scheme of medicine, that's not all that long.
Yeah.
Right now, I feel like I have pretty decent work-life balance. And again, I think a big part of why I'm not burnt out is because I like my job.
Yeah.
I like the specialty that I'm in. I like the environment that I'm in. I like the practice I'm working for. I like my attendings. So I think that helps kind of avoid burnout, But at the end of the day, my job is always going to be stressful no matter what. So maybe after some time, perhaps. But right now, I'm doing okay.
Awesome. All right. So that is all the questions I have for you today. Thank you for coming and taking
Thank you for
time
having me.
I appreciate it. You're very welcome. So guys, if you are interested in hearing a specialty, please let me know in the comments. Or if you actually are a PA and you think you have an interesting job, please email me at DaniThePA@gmail.com. That's 2 I's, DANII, thePA@gmail.com. I'm also on Instagram, TikTok, YouTube, all at DaniThePA. So please go follow me, subscribe, show some love. All right? Thank you for listening, guys.